Dr. Trish Leigh, I want to talk about the 3 types of neurofeedback as I see it. Now, other people will definitely see types of neurofeedback in different ways, just so you know, and I can see types of neurofeedback in many different ways. But for the purposes of the discussion today, there's 3 levels of neurofeedback. So, level number 1 is going into a professional office. We have the highest level state-of-the-art systems that we use internally in the office and for our home neurofeedback platform. All of the services are overseen by a licensed practitioner, and your doctor or your clinician are looking at your neurofeedback training graphs, if not every session, every couple sessions, usually it's every session, and they have their eye on your training or your treatment so that if anything needs to be individualized, and I'll tell you what that means in a second, it can be between sessions or really at any time. What we do is we'll do a full QEEG brain map, and we have a method of doing that for home neurofeedback too, if we need to. But we'll take a brain map assessment of a person's brain performance, and then we can set individual neurofeedback protocols for the very sites in your brain that need it, for the very way that we need to optimize your brain. And that can be different for every single person. So an in-office or a home neurofeedback program through a licensed practitioner is going to be highly specified. It's going to give you exactly what you need. We call it our brain shift program because our intention, which we succeed at most of the time, is we take brains that are highly dysregulated, those people with severe ADHD, severe anxiety, depression, physical challenges like pain and headaches, sensory processing disorders like tinnitus or misophonia, people who have addictions, and we can see that pattern in their brain because we know the science behind what all these brain patterns look like, and then we can shift the brain from that mode closer to the optimal mode, and the goal is to get it into the optimal mode, and we do that as fast as we can. So that's level number 1. That's the highest level of a neurofeedback program. Level number 2 is what I have created, especially during this time where people are at home more and more and people want services more and more. What we are also offering is neuro training and neuro coaching, because if you know me, I'm the coach. My background is brain health education, cognitive science, child development and disorders. I know about neurological disorders and degeneration across the lifespan, but my favorite thing to do is to coach people on what they can do in their own lives, hence these videos, to be able to better their cause. Most times it's contingent upon shifting their brain if they have big things going on. But my new neuro training and coaching program is especially for people who are struggling with anxiety that's onset because of something that has happened in their life. So they haven't struggled with an anxiety disorder their whole life, but now during a time of crisis, anxiety is set in, possibly burnout has set in, or an addiction has set in. And more people are struggling with drinking as an addiction and sexual addiction these days. So I am going to be here for you if that is something that you are struggling with in terms of coaching. But this is what we do. We use the Muse headband, one of my favorite things in the whole world. If you can't get in for neurofeedback with a licensed practitioner, the Muse headband has one proprietary algorithmic setting that is designed to help most people get their brain into the calm and focused mode. It's not going to be specific as going to a practitioner and having individualized protocols, but it's going to be great, especially if you're the person that I just described, burnt out, stressed out, struggling with drinking, struggling with watching pornography. If that's you, or if you have a child who has gone through a neurofeedback program and needs more support, or if you just want to continue supporting what has already been gained through a neurofeedback program, but now it's time to get coached on what you can do and change in your life, this awesome program is for you. So not only is it EEG biofeedback using the Muse headband, it also includes heart rate efficiency, breathing efficiency, body movement efficiency, sleep efficiency, One of my favorite things is personality testing and optimization. So I'll send you a link to a website where you can take a full personality test, and there's 9 types of personalities. Totally awesome. Your personality is basically driven by your childhood experiences and traumas. So then we know how we can optimize that pattern. You can become the best version of that personality type. Super cool. People love that aspect. Then I help you figure out what your authentic, true goals are, and then we make a plan with action steps so that you can move forward towards achieving that true, authentic person that you want to be. That's my favorite thing to do. I've done all of that for myself. Don't get me wrong, I'm a work in progress, but I've done that and I'm moving towards doing it more and more every day, and I want to be able to help people do that in my neuro training and coaching program. Okay, the last level is, especially in this time of need when people are stuck at home, I've created a service using the MuseCom headband that you just use your MuseCom headband by yourself at home, and for a super low cost, it is very low, based upon all of your sessions across the month. I'll analyze them within the sessions and across them, and I'll be able to tell you what's happening in your brain, and I'll also be able to give you specific tips, what you can do in the next month to optimize your brain pattern. I'll also be able to tell you if your brain pattern is very far away from optimal and you could benefit from some more support. So those are the 3 levels of neurofeedback. They're all awesome, but they fit different needs. Number 1, if you're diagnosed or you've been struggling with a challenge for a long time, you need a practitioner watching your program. Number 2, you want to level yourself up, or you really want more coaching, someone to help you make some good decisions and be able to put action steps in place. Number 2 is for you. Number 3 is you're feeling stressed out, getting back to life, and you're feeling stressed out and burnt out, and you're drinking more than you want to. Then you can just have me start looking at your brain so that somebody's looking at it and giving you some support. That's better than no support, right? It's definitely a start. Or if you've been through a full neurofeedback program and you're feeling great, but you want someone to keep you accountable, like a personal trainer. Once a month, I'll be able to keep you accountable and make sure that brain is moving forward and not moving backwards. Okay, I hope that helps. And remember, control your brain or it will control you.